AZCCC presents the Cancer Care Podcast, Arizona Center for Cancer Care. Comprehensive care with the highest quality of cancer treatment in Arizona. Joining us today, breast surgeon, Dr. John Davis.
Well, welcome.
Thank you for having me.
So let's just get right into it. And in general, just talk to us about managing breast pain.
So breast pain is a common symptom that many women experience. Breast pain does not increase the risk of having or developing breast cancer, and it's usually related to hormonal changes seen in the progression of the menstrual cycle. We think of this as two ways. So one is cyclical with the progression of the menstrual cycle, and the other is non-cyclical.
So for the average person, they feel breast pain, and they just assume right away that it's cancer.
That is not necessarily true. So there are studies out there that show that just because you have breast pain does not mean that you have or increase the risk of breast cancer. Usually breast pain is related to muscle pain or bone pain. Usually women carry heavy purses, carry their children in their arms, so this can usually cause a lot of breast pain.
Just give us your thoughts on the importance of people getting in to see you as early as possible if they feel any pain, or especially if they feel a mass or a lump.
Definitely, that's an important thing. So feeling a mass or lump can be common. We kind of use this as lumpy, bumpy breast, fibrocystic changes, and this is usually in their premenopausal patients. So when we see these patients, we usually kind of work them up. So anyone over the age of 30, we usually start with a mammogram, as Dr. Sigalov talked about in the last episode. But coming in and getting a physical exam so we can look and see the patient is usually the best thing.
So, Doc, I thought this could be kind of interesting with you. I'm going to mention a myth and get your thoughts on it, okay?
Sounds good.
All right, first myth. Breasts stop growing after puberty.
So that is a myth. Breast tissue continues to grow and change over time, and some women experience breast growth even into early adulthood. This may be due to hormonal changes, as kind of explained earlier, for example, pregnancy, as well as weight gain. Some women experience growth in one breast well after puberty. While it is important to make sure that this is normal, it is good to come and see a provider just to look at that.
All right, next myth. Dense breasts are abnormal.
That is a myth as well. Dense breast tissue is a consequence of age and hormonal changes. Some women have dense breasts into menopause and beyond. Dense breast is not a disease or not abnormal.
All right, next myth. I have breast implants, so I can't have mammograms.
So having breast implants does not mean you can't have mammograms. Mammography technologists use special techniques that allow them to image the breast tissue without being obscured by the implant. The risk of implant rupture is very low in mammography.
All right, another myth. I have dense breasts, so I should get MRIs instead of mammograms for my breast cancer screening.
So mammograms remain the gold standard for breast cancer screening, even in dense breasts. Screening breast MRIs are recommended for women who carry an inherited risk of developing breast cancer, such as those with BRCA gene mutations and women having higher than 20% risk of breast cancer in their lifetime. Having dense breasts is not an automatic reason to undergo MRI.
Oh, this one's interesting. All right, another myth. Pain or a lump in my armpit is not related to my breast.
Now, this definitely is a good one. It may or may not be. Your breast does extend into the armpit as a structure called the axillary tail. Also, lumps in the armpit may be caused by a lymph node. So axillary lymph nodes may be a normal condition, or it may be the first sign of breast cancer. It is definitely important to come and have that checked out.
Dr. Davis, a lot of good info today. Thank you.
Thank you.
Thanks for listening, and please join us again for the Cancer Care Podcast, presented by Arizona Center for Cancer Care. For more information on the highest quality of cancer treatment in Arizona, please go to ArizonaCCC.com.